As a wide range of businesses and activities have reopened in recent weeks, COVID-19 cases have increased in San Diego and across the nation. But there is a significant disagreement in communities large and small over whether or not to wear face coverings and keep at least 6 feet of social distance when people leave their homes and visit bars, restaurants, beaches, and many other crowded locations. A recent spike in the number of people testing positive has already increased the burden of local hospitals. 3 houses of healing in the South Bay have been among the hardest hit. At SCRIPPS Mercy Hospital in Chula Vista, workers have now been shouldering the heavy COVID-19 grind for more than 3 months.
Hardest parts a lot of times are trying to interface with the families as well and explain to them what's happening to their loved one and what we're having to do, and then go back and try and do that to the patients to get them better so that they can talk to them again.
Our unit is usually very successful getting patients off of ventilators, getting them out of the hospital in a really short period of time. COVID, I think that's what's been the heartbreaking, is that these people are here for weeks, over a month. Can't get them off their breathing machine. Sometimes they make it, sometimes they don't. And the number of people who die is just, is not comfortable for any of us.
Just a few miles to the north, Paradise Valley Hospital in National City recently accepted more than 30 patients from Imperial Valley, and its workers are bracing for increased admissions in coming weeks.
COVID has drastically changed our work environment. You don't really know what you're walking into anymore. We've had patients that we care for, and then later on they turn out to be COVID positive. So my coworkers have been exposed. There's been actual coworkers that have tested positive as well. You know, our safety is put into jeopardy just caring for our patients every single day.
It's changed everything for us. You know, what used to be a patient that may only need maybe a nurse and a physician, we saw 2-3 nurses needing to step in to care for these patients. So it's really changed the way we've done things. What I've seen is it has been sometimes affecting entire families, you know, where a whole family will end up going on ventilators, anywhere from, you know, the kids that are in their 20s to the mom in their 50s to the grandma in the 70s. It will affect the entire family, and that breaks my heart. People
are downplaying it. They don't see everything that we see. They don't see patients, you know, passing away, and nobody's there to hold their hand because we have guidelines in place where we don't want to expose the public, so they can't come in here and spend time with their family as, you know, they're passing away, and it's heartbreaking.
As the largest medical facility in the South Bay, Sharp Chula Vista Medical Center has also seen the largest number of COVID patients in the South Bay area. After several weeks with a patient census in the 30s, numbers surged to 50 by midweek.
We were doing so good, now numbers are picking up. We're seeing more patients from everywhere. We're opening the community, so it's scary to see what the future we have, what's gonna happen. Just you can get pretty anxious at times, just knowing, or not knowing what to expect.
Things that I've seen that really stood out is the abruptness of the disease. One day you'll be fine, you wake up one morning, patients will come in because they're feeling short of breath. Their oxygen levels are down, they're hypoxic, and within a few hours they're heading to the ICU and emergently getting intubated, and then they spend several days to weeks intubated, and progressively increasing oxygen requirements. And because of that, it's pretty dramatic, because every single time you go visit them, you have to gown up, gown down. The staff, it affects everybody. They're trying to contact the family, the loved ones. It's a pretty dramatic disease process, and it's not something that is usual.
If they make it out of here, they have an extremely long road ahead of them. Their quality of life, I mean, I can't say that it's ever going to be what it was pre-COVID.
We've heard a lot of talk lately that this is all a hoax. How about your reaction to that?
It would be the best hoax I've ever seen. This is the real deal. What we see here is people that are incredibly sick and they stay sick. And we're just glad to try and get them through it.
A lot of people, including myself before I got here, were really naive to the situation, and I would love for everybody to wear a mask so I can see my family again.
People may get together and everything seems fine, but then 2-3 weeks later, we start to see the uptick, and so potentially that might be what we're seeing here.
If you're sick, if you have a cough, fever, anything like that, maybe stay home. Think about the bigger picture. Think about everybody else that you might be, possibly spreading this to.
I wish people who don't believe the data, they don't believe that this is real, that this is just the flu, I wish they could spend an hour in this unit working with my staff. I think they would be shocked.
Just to be careful for yourselves, careful for your loved ones.
I don't want to see anyone in here, not to be a bad guy, but I don't want to see anyone. Outside is one thing, inside, don't wish anything for them like this.
Reporting for the San Diego Union-Tribune, I'm Paul Sisson.